And meanwhile, the president's chief medical advisor, Dr. Fauci, also took Paxlovid. He revealed that he had a rebound of his COVID symptoms after taking the drug, that in fact it was worse than the original symptoms he experienced. Now, his experience adding to the conversation about this issue, patients who initially feel better after starting the drug, but then have symptoms and sometimes even a positive test come back after finishing those 5 days. To date, cases of so-called Paxlovid rebound have been limited to small studies, some anecdotes shared on social media. So joining us to talk facts about this is Dr. Yalda Safai. Thank you so much for joining us.
Thank you for having me.
Well, today, President Biden's doctor said that his Paxlovid treatment is working, that his symptoms are improving. A question for you, is it still worth taking this drug if there's a chance of rebounding with worse symptoms after the initial course?
Okay, this drug is not meant for everybody at this point. The FDA gave authorization for it for a specific population, those over the age of 65 and anybody over the age of 12 that has an underlying condition like cancer, obesity, respiratory problems, diabetes. So it's only really authorized for this population. And the purpose of it is to decrease the chance of the illness progressing to something more severe and hospitalizations. Up until now, it's done a really good job at doing so. About 89% of people who take this drug have it's helped lessen the chance of progressing to a severe illness. So it's doing its job. And yes, there is a chance of rebound COVID, but still the benefits in this case outweigh the cost.
Okay, so Paxlovid really rose to the top in terms of treatment because it can be taken in pill form, it can be taken at home, and as you mentioned, those studies show how effective it can be. Are there any other treatments that are in the works right now?
Sure, there are two other authorized treatments. One was authorized back in 2020. It's an IV formulation of remdesivir. The only problem with that is it's because it's IV, it needs to be administered in an emergency room setting, which is not that convenient. There's also another pill formulation that was recently authorized, but by Merck, I believe is the pharmaceutical company that made it, and it was authorized by the FDA. The only problem with that is it's not as effective as this new drug. Only about 30% of patients had reduced symptoms of an illness. So up until this point, this is the best thing we got.
All right, Dr. Safai, thank you so much for your time.
Thank you.